We do have another testifier. If you can come forward. And Representative Poston, I haven't forgotten yet, so we'll keep the floor open to see if anyone from law enforcement wishes to weigh in. Welcome to the committee, sir. Please give us your name.
Hi, my name's Matthew Kaiser.
Welcome.
Thank you. I am a current medical cannabis patient in Minnesota, but I'm unable to utilize the medication in this state due to my circumstances. So I do utilize a hemp-based product. And I don't know if this is the specific issue that law enforcement has, other than, you know, the specific THC content in the extracts, but currently, under Minnesota's medical cannabis program, there's no raw flowers being sold, or what are being called buds. And the hemp products, there are. And so one of the problems that I can see from a law enforcement perspective, and something that I worry about, is the perception of being in possession of a hemp product, a full hemp product, a hemp flower, and it being perceived as being just plain cannabis. From a legal perspective, that's scary in my position. And then so I think some clarification on this is a legal product federally and at the state level, and this is not. I think some clarification on that would be great.
Very well. Thank you. Senator Edelson?
Thank you, Chair. Representative Vang, people sometimes use CBD, say in instances of having anxiety or chronic pain, possibly inflammation. Can you tell me, do you know that these CBD is being used in lieu of a different drug, say such as instance, if you have anxiety, you would take Xanax. Do you know any instances where this happens?
And actually, we had a patient here, perhaps can weigh in on that. Mr. Kaiser, please. Welcome back, Mr. Kaiser.
My name's Matthew Kaiser again. So yes, I am a medical patient who is unable to use medical cannabis that's provided by the state. So I do utilize CBD product, full spectrum hemp flowers, as they're called. And my diagnoses are PTSD and ulcerative colitis. So I utilize the CBD, the full spectrum CBD. It's as an anti-inflammatory as well as an anti-anxiety. It helps with my hunger. It helps regulate my sleep. There's a multitude of effects that the full spectrum cannabis products do provide, which I have found I can only get from a full spectrum product. I've diligently tried to find a product that will work because, unfortunately, the CBD market, it's expanding greatly with not a lot of oversight. So there's a lot of so-called snake oil out there that doesn't have the amount of CBD, it doesn't have what it's claiming to have. And so that is why I utilize a raw product in the case of flowers. And as I mentioned before, the full spectrum CBD product is what works. It works in conjunction with the trace amounts of THC, which are in such a small amount that they are not psychoactive in any way, but they do benefit greatly. And I utilize, like I said, for inflammation, so I'm on Pentasa and Remicade injections, and I've been able to get off of anti-anxiety drugs due to the CBD, as well as sleep, completely cut out trazodone, and forget one other one, but it was a few months ago for reoccurring nightmares.